Welcome to Lesson 2.4, Infection Control and Standard Precautions. Infection prevention is part of every care partner's job. Many of the people we serve may be older, medically fragile, recovering from illness, or living with conditions that can make infections more serious. The goal of infection control is simple: protect the client, protect yourself, and prevent germs from being carried from one person, object, or surface to another. CDC recommends standard precautions for all patient care, regardless of whether a person is known to have an infection. Standard precautions are infection prevention practices used when caring for everyone, not only people who are known to be sick. This means you should not wait until someone tells you that a client has an infection before protecting yourself. Blood, certain body fluids, secretions, non-intact skin, and mucous membranes may contain infectious organisms. Standard precautions include hand hygiene, appropriate use of personal protective equipment, respiratory hygiene, safe handling of contaminated materials, and proper cleaning practices. Germs are often spread through ordinary activities. You may touch contaminated bedding and then touch a clean surface. You may assist with toileting and then prepare food without cleaning your hands. You may touch a contaminated doorknob and then help another person. Infection control is largely about breaking that chain of transmission. Your hands are one of the most common ways germs can travel during caregiving. Proper hand hygiene protects both you and your client. CDC recommends cleaning your hands immediately before touching a patient, after touching the patient or their surroundings, after contact with blood or body fluids, and immediately after removing gloves. Hand hygiene should happen throughout your shift. Clean your hands before providing personal care. Clean them when moving from a dirty task to a clean task. Clean them after helping with toileting or incontinence care. Clean them after touching blood, urine, stool, drainage, or contaminated materials. And always clean your hands after removing gloves. Gloves do not replace hand hygiene. When washing with soap and water, wet your hands with clean running water and apply soap. Rub all surfaces of your hands, including the backs of your hands, between your fingers, fingertips, thumbs, and underneath the nails. Scrub for at least 20 seconds, then rinse thoroughly and dry your hands. CDC recommends at least 20 seconds of hand washing. Alcohol-based hand sanitizer is appropriate and actually preferred by CDC in many routine healthcare situations when hands are not visibly dirty. But there are situations when soap and water should be used. That includes when your hands are visibly dirty after using the restroom and before eating. CDC also recommends soap and water during certain outbreaks involving infections such as C. difficile or norovirus. When using sanitizer, cover all hand surfaces and rub until dry. Gloves provide a barrier between your hands and potentially infectious material. Wear gloves whenever you reasonably anticipate contact with blood, body fluids, mucous membranes, broken skin, or contaminated materials. This may include incontinence care, perineal care, cleaning body fluid spills, or handling heavily soiled laundry. CDC recommends gloves as part of standard precautions when this type of exposure is anticipated. Wearing gloves does not mean your hands are clean. Gloves can develop small tears, and your hands can become contaminated while removing them. Perform hand hygiene before putting gloves on when required for the task, and always clean your hands immediately after glove removal. Gloves are not meant to be worn throughout an entire shift. For example, imagine you're providing incontinence care. You should not use the same contaminated gloves to then brush the client's hair, prepare their meal, or touch clean bedding. Remove the dirty gloves, clean your hands, and use new gloves if the next task requires them. CDC specifically recommends changing gloves when moving from a soiled body site to a clean site, and whenever gloves are damaged or contaminated. This example demonstrates cross-contamination perfectly. A caregiver finishes incontinence care while wearing gloves. Then, without removing them, they pick up their phone, touch a doorknob, open the refrigerator, and begin preparing lunch. The gloves have now spread contamination everywhere. Gloves are protective only when they're used correctly. Personal protective equipment, or PPE, includes more than gloves. Depending on the situation, PPE may include a gown, mask, eye protection, or face shield. The equipment you need depends on what exposure you reasonably anticipate. For example, if you're performing a task where body fluids may splash toward your face, additional protection may be appropriate. Follow the client's care instructions and agency infection control procedure. CDC's standard precautions call for PPE whenever exposure to infectious material is reasonably expected. Remember that once PPE has been used during a contaminated task, the outside of that equipment may also be contaminated. Don't touch your face. Don't answer your personal phone with dirty gloves. Don't touch clean surfaces unnecessarily. Remove PPE carefully. Dispose of or handle it appropriately, and perform hand hygiene. Respiratory infections can spread through coughing, sneezing, contaminated hands, and surfaces. Cover coughs and sneezes appropriately, dispose of tissues, and clean your hands afterward. If a client has respiratory symptoms, follow the client's care instructions and agency procedures regarding masks or other precautions. Standard precautions include respiratory hygiene and cough etiquette. Care partners also have a responsibility not to knowingly expose vulnerable clients to illness. Don't hide significant symptoms because you're worried about missing a shift. Notify the agency according to call-out and infection control procedures. The agency can determine whether it is appropriate for you to work or whether additional precautions are necessary. Never simply show up sick and hope nobody notices. Georgia's private home care provider rules specifically require employee orientation to include the employee's obligation to report known exposure to tuberculosis and hepatitis to the employer. Do not keep this information to yourself. Notify the appropriate agency representative so the necessary follow-up can occur. If blood or another potentially infectious material contacts broken skin, your eyes, mouth, or another mucous membrane, take the situation seriously. Stop what you're doing safely. Wash exposed skin or flush exposed mucous membranes appropriately. Immediately notify your supervisor or administrator and follow the agency's exposure control procedures. Do not wait several days to mention the exposure. Even though care partners generally don't perform nursing procedures unless appropriately qualified and assigned, you may encounter needles or other sharps in a client's home. Never reach blindly into trash. Never handle a used needle with bare hands. Never improvise with sharps. Follow the client's care plan, agency procedures, and established sharps disposal process. Report unsafe sharps conditions to your supervisor. Cleaning and disinfecting are related, but they are not exactly the same. Cleaning removes dirt, body fluids, and other material from surfaces. Disinfecting uses an appropriate product to destroy many disease-causing organisms. Follow product directions carefully. More chemical does not automatically mean better cleaning. High-touch surfaces can become contaminated very quickly. Depending on the client's service plan and your assigned homemaking responsibilities, these surfaces may require routine cleaning. Use the appropriate products and follow agency and manufacturer directions. CDC emphasizes environmental cleaning and disinfection as part of core infection prevention practices. Never create your own cleaning mixture unless specifically instructed by an approved procedure. Certain household chemicals can release dangerous gases when mixed. Follow the label. Use adequate ventilation. Wear appropriate protective equipment. Keep cleaning products away from clients who could accidentally ingest or misuse them. Sheets, towels, and clothing contaminated with urine, stool, blood, vomit, or drainage should be handled carefully. Avoid shaking contaminated laundry because that may spread material into the surrounding environment. Don't press heavily soiled laundry against your uniform. Use gloves when exposure to body fluids is anticipated, and perform hand hygiene afterward. CDC advises contaminated patient care items be handled in ways that reduce transmission to workers, other patients, and the environment. Incontinence care is one of the most common opportunities for cross-contamination in home care. Wear appropriate gloves. Keep contaminated materials away from clean supplies. Change gloves when moving from contaminated care to clean tasks. Dispose of waste correctly. And always perform hand hygiene afterward. Infection control never replaces dignity. Continue protecting the client's privacy during the entire process. Care partners may also prepare meals. Food preparation introduces another opportunity for infection. Wash your hands before handling food. Don't walk directly from toileting or personal care into the kitchen without proper hand hygiene. Keep food preparation surfaces clean and follow proper food safety practices. Reusable care equipment should be maintained according to agency instructions and manufacturer guidance. Don't take contaminated equipment from one person and use it on another without proper cleaning and disinfection. CDC's core infection control practices require appropriate reprocessing of reusable medical equipment before reuse. Infection control doesn't stop when you remove your gloves. Think about what you're touching during care. If you're answering your phone while wearing contaminated gloves, your phone is now contaminated. Later, you touch the phone again with clean hands. That's how germs travel. Keep personal belongings away from contaminated work areas whenever possible. What's wrong? Removing gloves does not eliminate the need for hand hygiene. The care partner must clean their hands before beginning food preparation. CDC recommends hand hygiene immediately after glove removal. This is cross-contamination. The gloves used during the contaminated task should be removed. Hands should be cleaned. New gloves should be used if the next task requires them. Dirty to clean transitions require special attention. Do not simply report to the client's home without saying anything. Contact Agnes and Sandy's Caring Hands immediately according to the agency's call-out procedure and report your symptoms. Vulnerable clients can experience serious consequences from infections that might be relatively mild for someone else. Immediately flush the affected area appropriately. Notify your supervisor or administrator right away. Follow the agency's exposure procedures and obtain medical evaluation as directed. Do not simply finish your shift and mention it several days later. Do not pick them up with your bare hands. Keep yourself and the client safe. Follow the established SHARPS procedure and immediately report the unsafe condition to your supervisor so appropriate corrective action can be taken. Most infection control failures aren't complicated. They're usually basic mistakes. A rushed caregiver skips hand hygiene. Someone leaves contaminated gloves on too long. Someone hides an illness because they don't want to miss work. Infection prevention requires slowing down long enough to perform basic procedures correctly. Care partners should observe clients for changes. You are not responsible for diagnosing an infection, but you are responsible for noticing and reporting significant changes. For example, a new cough, fever, unusual drainage, persistent vomiting, diarrhea, or sudden change in condition should be reported according to the client's service plan and agency procedures. Georgia's PHCP orientation rules specifically require employees to learn how to report client progress and problems to supervisory personnel. Remember 4 words: clean, protect, separate, report. Clean your hands and work surfaces appropriately. Protect yourself with PPE. Separate contaminated items from clean items, and report exposures, illness, unsafe conditions, or significant changes in your client's condition. Infection prevention is not one special task that happens once during a shift. It should influence everything you do. Your hand hygiene, glove use, cleaning practices, food preparation, personal care, and handling of contaminated materials all affect client safety. Use standard precautions consistently, follow Agnes and Sandy's Caring Hands policies, and never hesitate to report an exposure or infection control concern.